Hello everybody. Today, as I was planning to make a internship video for you, uh, and for this first video, I was planning to share my UDOH experience with you. I am doing an internship with Utah Department of Health. It's the government part of the health department that is of Utah. I'm sorry. Yeah. So I was working with the Utah Department of Health, and I got this opportunity via University of Utah. And so what I did in this internship, what I did was I worked with the CDC, Utah Department of Health, and a lot of other departments to help in the bending of the COVID curve. So now, as we are getting, luckily, we are getting lesser number of cases comparatively. Like, if you're gonna compare the numbers from last year to this year, the numbers are pretty much better. And so what I did in my position, so first we did contact tracing. So what does we do in contact tracing? This is I feel like it's the most simplest job, like as compared to other positions. I manage other positions too, so but let's do it sequentially. So what you do in this, like, you contact people who are COVID positive, or you contact people who got exposed to COVID positive people, and you talk to them. You see if they need any financial help. You advise them about getting tested if they're contact, or you advise them to go for isolation, and then you give them instructions that are important for isolation. You share COVID-19 education material. It's like we email them those important details, and if they're a specific community, then you answer their questions. Like, there are a lot of people who believe that COVID doesn't exist, but you cannot just let them go by saying that stuff, right? So you need to talk to them, and you need to, like, take care of their emotions too, and talk to them on the basis of facts. And the best part about science is, like, 2 plus 2 is 4, and it's a fact. No holy book, no moral, no, like, humanity, or I can say no topic that can have, like, bi-directional answers can prove it wrong. So it's like, so when you talk to people on the basis of facts, that's the benefit of facts. Like, they cannot just contradict you on the basis of their morals or their religious values. So that's how we dealt with that communities. Next, I did manage to contact healthcare workers. For example, there are a lot of people, COVID positive people, like, when they didn't know about that they're positive, they didn't had symptoms at that time, because you can spread COVID 2 days prior of your actual symptomatic period. So sometimes they do just visit hospitals or nursing homes, so you need to notify the healthcare center that they got exposed, and then you need to give them instructions, and then you need to start the healthcare investigation. In that, you take contacts from that healthcare center, and then you contact those contacts and ask them to isolate. And it's different chain. And as now we are getting vaccination, we are running vaccination drives. So yeah, we right now Utah Department of Health is using 2 vaccines, Pfizer and Moderna, and they both are in, like, available in 2 shots. Like, you need to get 2 shots to complete the course, and they had, like, a time difference of 20 or 28 days depending on the vaccine. So, like, if it's Pfizer or Moderna. So I worked with the with vaccination drive too, and I'd give instructions to the people, like, which vaccines they are getting, and I need to answer their questions, and we need to keep a track that if they are getting their vaccines on time. We need to see that if they're maintaining social distancing. We need to keep a track of it, that if everybody's fine, and Then there is a clinical area, then there is preclinical area. Preclinical area is about numbers. You just keep their track that who visited the center, who did not, who needed to contact, and who have already been contacted and has not responded. You need to keep all that track. So this is a really interesting experience of mine. I'm learning so many things, I'm dealing with so many people, and I'm like, one day I work with the contact tracing department, the other day I work with the healthcare investigation department, and there are times when I work on site. So it's going really amazing. And yeah, it's a paid internship, so they're paying me like, I think for this position they're paying me $20 an hour. And every morning, like I'm working like 3 shifts a week, and we get into a group chat every shift, and there might be chances we get the same team leader, sometimes we don't get the same team leaders, like it's super random. And then you get in a group of 15-16 people, and you start taking cases. You start, depending on the position that you are on that day, if you're doing contact tracing, if you're doing investigation, community investigation, or if you're doing healthcare investigation, it completely depends. And what I do is, contact tracing is like both kinds. It's on-site and off-site. So most of the time I do online contact tracing, but when I work with the vaccination drive, I do on-site vaccination drive. So yeah, and in my later series I will tell you that how I got that internship, what I did with my resume. I think resume is like simple. I already made a video on resumes, and I created my resume following the instructions I myself gave in my previous video. So things are pretty good right now. Hope they stay the same, and I'm glad that we're getting lesser and lesser number of cases every day. People are getting better, and people are getting serious about vaccinations, getting vaccines, and a lot of people are feeling fine. Like, they do feel feverish or sick on that day, because it means that the reaction is going on in your body. And some of them getting a sore arm on that day, and it's a really common symptom. So don't be scared if you get a sore arm, because everybody's getting it. And I feel like this is a good indicator that nothing super unusual is not happening to you. It's completely normal. You're getting normal symptoms like everybody, and so there are higher chances that the vaccination is working in the same way as it is working with some other people. So this is cool. Hope I told you some good interesting facts about my new position. And like, I'll be working with this on this position till April, and then I might go for another internship, but I don't know. I am graduating this fall semester, so it's a lot of things, and I am going to apply to PhD schools too. And once I'll get into it, I'll share how I got into like straight PhD. In America you can skip masters, so with the STEM field, so you can take advantage of this flexibility. I will share everything. I have like so many things to share, but I didn't got the opportunity because a lot of things are going because it's like a lot of things happening at the same moment, so I'm not getting time to share my experiences with you. But I really want to share it, and I will do it when I'll get an opportunity. So good luck with your internships. Try to find internships. Don't hesitate to apply for anything. Like, don't like kind of, there are sometimes it happens to me too. Like, when I'm applying to a position, I'm like, do I really deserve it? Then I answer myself like, it's okay to apply, because if you're not gonna apply, the answer is always going to be a no. But if you will apply, you never know. So there might be chances that you get a yes, and if you get it, like, when there's a situation when that you have nothing to lose, then why are you so hesitant to apply? So always apply when there is like no damage. Like, you applied, you got it, awesome. You didn't got it, it's fine. Okay, so I think that's all for today. Have a good day. Bye bye.